My Achilles tendons have been inflamed multiple times in the past, each time for several weeks. Because my Achilles tendons were painful, I could barely walk. Therefore, I tried several different remedies. What's the best remedy for inflamed Achilles tendons? First, I will show the problem with inflamed Achilles tendons. Then, I will show you a short-term solution like orthopedic inlays, silicone heel protection, the cream Traumeel, and a change in sleeping position. Then, I will hint on long-term solutions, switching off a chronic inflammation. The problem. My Achilles tendons inflamed multiple times a year for several weeks each time. With painful Achilles tendons, I could barely walk. If I was lucky, I could use a handrail and carry some of my weight with my upper body, with my hands and my arms, to burden my feet less and reduce the pain. My walk was slow, painful, and I limped. With inflamed Achilles tendons, you not only suffer from pain, but also from embarrassment. If you are a young person and limp through university, you feel quite uncomfortable. Everybody can see you in your bad condition. I sought help from an orthopedic doctor. My health insurance claims report show all my doctor visits. Here is one example from the year 2009 and 2010. In the year 2009, my Achilles tendons were inflamed twice in April and September. Only 1 year later, I suffered from another inflammation. My health insurance claims report shows the date I visited each doctor, the name of the medical doctor, and the diagnosis. In this case, inflamed Achilles tendons. The type of diagnosis. G means gesichert, it's a certain diagnosis. And B means Verdacht. This means a probable diagnosis. Additionally, the report shows the payment from the health insurance company to the doctor. You can see from the report that my doctors made certain diagnoses of inflamed Achilles tendons for years, multiple times a year. So what helped me? Orthopedic inlays. The prescription of my orthopedic doctor can be also seen in the health insurance claims report. The orthopedic inlays he prescribed made walking only slightly more comfortable for me. The improvement was rather limited. Silicone heel protection. For inflamed Achilles tendons, silicone heel protection were very helpful for me. How did it help? During the times my Achilles tendons were inflamed, for my feet, the most comfortable angle was somewhat more than 90 degrees. Pulling my feet up was very painful. Thanks to the silicone heel protection, I could walk without pulling too much on my Achilles tendons. Also, every step on the floor will push your heel. The silicone heel protection provides a cushion to reduce the pain. The cream Traumeel. I also had positive experiences with the cream Traumeel, which my orthopedic doctor prescribed. After I picked up the cream from my pharmacy, I read the cover. The cover stated the cream was homeopathic. Homeopathy is a pseudo-scientific system of alternative medicine. No homeopathic preparation has been shown to be different from a placebo. I believe in science, and homeopathy is not science. I assumed it only worked if you falsely believe in it. However, since I didn't believe in it, I thought it definitely doesn't work for me. I was also a bit disappointed by my orthopedic doctor. I came to him with real pain and all he gave me was a fake medication. Since I already had the cream, Traumeel, I tried it out. And it really worked pretty well. I was pretty surprised. I used the cream several times and it seemed to work every time. It should not work, but it did, even if I didn't believe in it. So I changed my mind. It may be unscientific, but as long as it works, I'm fine with it. Sleeping position. To keep pressure off my heels, I modified my sleeping position. If I lie on my back, I will stick my feet slightly out of the bed. As a result, the bed doesn't touch my Achilles heels. This can be also useful as a preventive measure if you suffer from chronic inflammation. Switch off chronic inflammation. The methods I described previously help me to lower my level of pain. However, it is important to tackle the source of the pain. For me, it was a chronic inflammatory disease called ankylosing spondylitis. I discovered how to switch off the inflammation and the pain from ankylosing spondylitis without medication. Without pain, I don't need silicone heel protection or pain-reducing creams. How did I turn off my ankylosing spondylitis? This is a topic for another video. My conclusion. In the long run, you have to find the source of your inflammation to prevent suffering from inflamed Achilles heels over and over again. In the short run, a combination of silicone heel protection and the homeopathic Trameal cream reduced my pain level during walking around 75%. The silicone heel protection reduced the pain by around a half. It made walking possible again, where previously I could hardly walk. Therefore, I can definitely recommend silicone heel protection for acute pain. The homeopathic cream Trameal also cut the pain in half. Together, the cream and the silicone heel protection were very helpful. The orthopedic shoe inlays, on the other hand, had only a minor positive effect, maybe 5 or 10%, maybe also nothing. But certainly they didn't hurt or make the situation worse. Did you suffer from Achilles tendon inflammation? What was helpful for you? Help others with your experience.